Hello.
Hello.
Hello, doctor. കേൾക്കാം അല്ലേ? ശരി ശരി.
നമുക്ക് ജാസ്മിൻ ജോയിൻ ചെയ്യൂ ഇപ്പോ?
ആരാണ്?
ഡോക്ടർ ജാസ്മിൻ ജോയിൻ ചെയ്യുന്നു പറഞ്ഞിരുന്നേ. മരിയ ഡോക്ടറെ ജോയിൻ ചെയ്യൂ? എനിക്കറിയില്ല, രണ്ടുപേരെ ഞാൻ കണ്ടുള്ളൂ. അത് ചോദിച്ചു.
ഡോക്ടർ ജോയിൻ ചെയ്തോളും. ഞാൻ വിളിക്കണോ ജാസ്മിൻ ഡോക്ടറിനെ? ഡോക്ടറെ ഞാനുണ്ട്. മറിയ ഞാനുണ്ട്. കേൾക്കുന്നില്ലേ മറിയ? കേൾക്കാൻ കാണാതിരിക്കുന്നേ? അന്ന ഡോക്ടറാണോ അത്?
വിട്ട് പോകണ്ട കേട്ടോ.
അതെണ്ട് ഡോക്ടറെ, തന്നെയാണ്.
എന്റെയാണോ കണക്ഷൻ വിട്ട് പോകുന്നേ?
ചെറിയൊരു ബ്രേക്ക് ഉള്ള പോലെ ഉണ്ട്.
ഒരു മിനിറ്റ്, വൈഫൈ കണക്ട് ആവുന്നില്ല.
ഇന്ദു ഡോക്ടർ റേഞ്ച് ഒന്ന് നോക്കിയാ കേട്ടോ, റേഞ്ചിന്റെ ഒരു ഇഷ്യൂ ഉണ്ട്.
ഇന്ദു ഡോക്ടറുടെയും മരിയയുടെയും റേഞ്ചിന് വിഷയമുണ്ട്. ഗുഡ് മോർണിംഗ്.
ഗുഡ് മോർണിംഗ്. എന്റെ റേഞ്ച് ഇടയ്ക്ക് പോവേ. ഞാൻ കോട്ടയത്താ. ദീപ് ഡോക്ടർ രമ്യ ഡോക്ടറിനെയും കൂടെ കോ ഹോസ്റ്റ് ആക്കണേ.
ആക്കിയിട്ടുണ്ട്.
ശരി ശരി, ഓക്കെ. മാം
എന്നെ കാണാമോ? എന്നെ കിട്ടുന്നുണ്ടോ ഇപ്പൊ?
കണ്ടില്ലല്ലോ. ഇത് ഡോക്ടർ വീഡിയോ ഓഫാണ്.
എന്റെ വീഡിയോ ഓഫാണ്. ഓഡിയോ കിട്ടുന്നില്ലേ? ഒരു മിനിറ്റ് ഓണാക്കാട്ടാ, കുറച്ച് പണിയിലായി പോയി.
മാം ജോയിൻ ചെയ്തിട്ടുണ്ടോ?
ഉണ്ട്. നമ്മൾ പറയുമ്പോൾ ജോയിൻ ചെയ്തോളൂ.
ഓക്കെ. മാമിന്റെ നെറ്റും ചെക്ക് ചെയ്യണ്ടേ ദീപു? ഒന്ന് സംസാരിക്കാമായിരുന്നെങ്കിൽ ചെക്ക് ചെയ്യായിരുന്നു.
എനിക്ക് തോന്നുന്നു നേരത്തെ ചെക്ക് ചെയ്തെന്ന് തോന്നുന്നു രമ്യ ഡോക്ടറെ.
ആ
മാം
ഓക്കെ
10:30 ജോയിൻ ചെയ്യും, ചെക്ക് ചെയ്യും എന്നാ പറഞ്ഞത് ദീപു ഡോക്ടർ. എനിക്ക് തോന്നുന്നു ഓൾറെഡി ചെക്ക്ഡ് ആയിരിക്കും അത്.
ഓക്കെ.
എന്നെ കാണാമോ? എനിക്ക് ആരെയും കാണുന്നില്ലല്ലോ.
ഇല്ല.
കാണാമോ? ഇപ്പൊ കാണാമോ?
അന്ന ഡോക്ടറെ കാണാമോ? ഇന്ദു ഡോക്ടറിനെ?
അതൊക്കെ സെറ്റ് ആക്കാം.
ആ, അന്ന ഡോക്ടറെ കാണാം. അന്ന ഡോക്ടറെ കാണാം.
ഇന്ദു ഡോക്ടർ ഓഡിയോ ഇപ്പൊ ക്ലിയറാ.
മറിയൊക്കെ എവിടെയാ?
ഞാൻ കോട്ടയത്താ.
അതെ, നെറ്റ് ഞാൻ വൈഫൈയിലേക്ക് പോയി. ഞാൻ ഇതിലായിരുന്നു, ഫോണിന്റെ നെറ്റ് ആയിരുന്നു, അത് ഇവിടെ സ്ലോവാ. ഇപ്പൊ ഓക്കെ ഇല്ലേ?
ഇപ്പൊ ഓക്കെ.
ഓക്കെ.
Dr. Sunita ma'am, can you hear us?
I can hear you.
Okay. Good morning, ma'am. Yeah.
ഇന്ദു ഡോക്ടർ
Ma'am, can you
കിട്ടുന്ന പോലെ ഒരു റൂമിനകത്ത് ഇരുന്നാട്ടെ, ഒരിടത്ത് നല്ലതായിട്ടെങ്കിൽ ഇരിക്കും.
ഇരിക്കാൻ പോണേ.
Sunita ma'am, can you share the screen, ma'am? I think you.
ഒന്ന് കൊടുത്തു.
Okay.
Just a moment, when I am checking the YouTube, actually there is an issue with the YouTube. Just a moment. Okay, ma'am, it's working, ma'am. You can stop the sharing. We will start it after the introduction. Okay. Okay. Maria Doctor, ഒന്ന് മാഡത്തോട് സംസാരിച്ചു കേട്ടോ.
മാം ഗുഡ് മോർണിംഗ്. സുനിത മാം, ഡോക്ടർ മറിയ.
Good morning, Dr. Maria.
Yeah, good morning, ma'am. Welcome to the seminar, ma'am. Can we start, Deepa Doctor? Can we start?
Yeah, we can start now. No problem.
Indu Doctor, are you ready? No, we can start now. Indu Doctor.
കേൾക്കല്ലേ മറിയ?
Can you hear us? Yeah.
Hello.
We can start, doctor, now. We can start now. You can hear now?
Okay.
Yeah, we can start now.
Okay. Everybody is there? All are present?
Yeah. Yeah, you can start now.
Okay, Maria. Okay. Hi, good morning all. Hi, good morning all. We are here gathered for the webinar series conducted by Women's Wing IHMA on the topic joint pains. So I invite Dr. Anna for the faculty introduction.
Thank you, Dr. Indu.
Okay.
Good morning, doctors. I am Dr. Anna. And with immense pleasure, I welcome you all to yet another weekend series of Illumine 2021, which is hosted by IHMA Women's Wing Ernakulam. Today's topic is the homeopathic management of joint pain. And IHMA presents before you an eminent faculty, Dr. Sunita Gandhi. It's my privilege and with immense pleasure, I introduce you to Dr. Sunita Gandhi. Dr. Sunita Gandhi is a senior homeopath with a well-experienced clinical practice. She graduated homeopathy from Mumbai and completed her graduation from the London College of Homeopathy, where she was mentored by world-famous homeopath Dr. Parinas Hamranwala. Also, she did her fellowship from the Other Song International Academy of Advanced Homeopathy under the guidance of veteran doctors like Dr. Rajan Shankaran and Dr. Jayesh Shah. Dr. Gandhi has put up her own clinic at Andheri and is practicing there since the last 25 years. It is needless to say that she has a vast clinical experience. Also, she has a passion in teaching the art and science of homeopathy. She is a regular faculty of advanced techniques in the practice of homeopathy at various.
Hello, Anna? Dr. Anna?
Actually, she's having a network issue, I think.
Network issue. So we can start the session, right? Okay.
No, we can. We should introduce ma'am. Okay.
Okay.
Just a moment. I will. I think she has read about more thing about ma'am.
She's
Yeah,
come
ma'am.
back. She's come back.
Anna has
Just wait,
returned.
she's coming.
Yeah. So then we can start. No problem. Yeah. Okay. Dr. Sunita, you can start the session. I think some network issue with that. Actually.
Okay, no problem. All right. Good morning, everybody. It's a pleasure to see all of you. Just a request, if all can shut down their videos, so then it becomes easier, and their audio while I make the presentation. Thank you so much, everybody. So thank you very much. I extend my gratitude to IHMA Women's Wing for inviting me for this session. Dr. Deepu, especially, who has been very vigilant, and he has been talking to me on a regular basis on how and what is expected. So thank you for your inputs. So I'm very glad to be here and to speaking to this audience. I have done it before with you all previously, and it's great to be back. So today we are going to discuss and talk about a very interesting topic, something that comes to us every day, in our practice. So it becomes essential and vital for us to understand it better. So we are going to be talking about the homeopathic management of joint pain. I mean, as small as it sounds, as those people who suffer from it, who go through it, it kind of interferes with their daily life and can cause a lot of problems. So let's see, how we can help. I hope my screen is visible. So, you know what, intermittently I'll put on the chat box. If there is some question you can ask, I will also allow people to ask questions in between, but I'll open chat box as and how time goes. So would be good to be interactive also if there's a problem. Otherwise, in the end, we'll have a 15-20 minute of long question answers. So see, my idea today, will make it very clear, is not to teach you everything about what is available in orthopedics with joint pain, but it is my endeavor to get you start thinking in the right direction, to understand the basics, and take this as a point where you can further your information and further your knowledge, and your convert it into practice. So I'm sharing some of my experience with the belief that you will take it and go advance on it. Yeah. So let's begin. We will talk about how we can manage joint pains. So, what is the approach? When a patient comes to us with joint pain, what do we do? What's the first thing that happens? I think the first thing is you need to take a history. And by history, I do not mean our case taking or our case history. That's step 2. You need to take a short, quick history, because a joint pain can be of 2 origins. It could be an acute pain that has happened because of an acute problem right now, like a child is playing in school and he falls down and he's got a swollen ankle, and the patient is brought to you by the parents. What do? You don't go into the whole case taking that we normally would do. We'll take a short history of what happened, how it began, what was the child doing, how was the injury, and you will get into the examination of the child. So history is very important. Was it a long-standing ailment? Then you will take a proper case and do a proper homeopathic constitutional prescription. But if it's a pain that has come up because of a fall, of an injury, of a sudden origin, then I think a short, quick history is very vital to understand. And you need to be quick with what you would want to do with the patient. Would you want to send for an immediate X-ray to find out if there's been a deeper problem, like is there a fracture, is there a dislocation, what has happened? So joint pains, the approach can be in two different methods, an acute approach and a chronic approach. So first thing, taking the history, very vital. Second, once you have established that, okay, it does not require immediate attention, as in, going for a procedure, you now need to take the proper case. You need to find out location, sensation, modalities, concomitant, as you would take in a normal homeopathic history. After getting the whole details, very, very vital to examine the patient. I think not just for joint pains, colleagues and friends, I think we need to examine all patients whenever they come to us. And in joint complaints, very, very vital. You can go through the whole topic of examination, how you would examine the range of motion, if there's kind of any swelling, redness, inflammation signs and symptoms that you could see, and so on and so forth. So once your examination is done, you will run your patients through a few investigations if required. And if not, it's fine. But most times in joint pains, we have seen that we might require, if it's a chronic joint pain, then there will be a set of different investigations depending upon what you think your diagnosis is going to be. And finally, you will make a prescription. And today, I'm going to talk to you about the prescriptions and how you will manage joint pains with an acute or a constitutional. And I'm going to do both. So, nothing is more important or less. I think both are very, very essential. So I will be running you through some acute prescriptions and I'll be running you through some constitutional prescriptions, right? Let's go forward. What can be the causes of acute pain? Something that has happened recently. It could be an injury, a fall. It could be a sprain. It could be a strain that could cause a tendinitis. There could be pain for a few days. Probably the reason could be a bursitis, a bursitis of the shoulder joint or the elbow joint, wherever. And again, here you'll need to find out how it began, what aggravated it. Is it for the last few days or it is something that has been going on for some time? So very, very essential. There could be many reasons. I've just kind of jotted down. There could be a dislocation that can lead to acute pain. Overuse. This is an underused statement, but it's overuse of a joint. I had a patient who came up with severe joint pain in the arm, and I wasn't really sure that there was any kind of injury, there was any kind of, fall that had happened that could have caused that pain in the arm. And then I realized that that patient was a basketball player, and there was the patient needed to, play and was throwing the ball all the time, and there was constant pressure on his shoulders. And what he got was tendinitis, like what we call a rotator cuff tendinitis. So overuse can be one of the reasons. So our history is very, very vital when we are talking about acute pain. And of course, there are some systemic causes of joint pain. I've listed a few. There are many more. But what we commonly see coming to us can be osteoarthritis, which is a degenerative disorder, rheumatoid arthritis, which is an inflammatory autoimmune disorder, ankylosing spondylitis, gout, and many more. So let's understand now that what exactly happens to a healthy joint. So before that, we need to know what is a healthy joint. So if you will, see the picture in front of you, this is a knee joint in the picture. You have one bone above or below, and this is the joint. This is the problem in many parts of chronic joint pain. This is a cartilage. Cartilage is the end of a bone. It's something like a softer bone. It's also part of the bone. Like our pinna is made of cartilage. So if you will touch this pinna and see, it's firm, but it's not as hard as a bone. So it's a softer bone, and it's the end of each bone has a cartilage. And this cartilage allows for the free movement of the joints. Like if this is your knee joint, let's say this is your knee joint this way. So the knee joint needs to move, when you're walking, when you're sitting. For every movement of the knee joint, the joints are constantly moving. So what happens is that this cartilage allows for the free movement of the joints. And this is a soft bone that does not cause friction. Then we have this as a joint capsule. We have a lining of the joint capsule, the inner lining called as the synovium. And the fluid, that keeps lubricated our joint is called the synovial fluid. Okay, so this makes up a joint. Also, very important in our joint is this muscle and the tendon. So, we have muscles all around our body, and where the muscle joins the bone, it is joined by a tough muscular structure called a tendon. And very often, when our patients complain of joint pain, it is the tendon that is affected. And, there could be a tear in the tendon, there could be an inflammation in the tendon. A lot of times, even this, not just the joint, it would mimic a joint complaint, but it could be a problem of either the muscle or the tendon. So again, a proper history taking with the examination and investigation will help us find out which part of a healthy joint is become unhealthy. Let's see a few reasons and the causes of certain systemic conditions. Most common for us to understand. Why I'm going to be talking a little bit about the conditions before I actually go into the therapeutics is because if we understand what is there, then we know how we treat it. Then we know how we go about further. So let's understand osteoarthritis right now. Osteoarthritis, it involves a wear and tear of the joints cartilage. I described to you the end of the bone, which was a cartilage, the soft bone like the pinna. That's the time where you see an osteoarthritis, which is age-related, it starts wearing off. And the cartilage cushions the ends of the bones and it allows a frictionless joint movement. But when there is damage to the cartilage, the bones start grinding against each other. And when the grinding happens, it can cause a lot of things. It can cause pain, it can cause restricted movements, it can cause stiffness. Many things. But this is the primary cause of it. This does not happen immediately in most times. It's an ongoing process. It's a degenerative damage that happens with age. But sometimes, we have a history. Like I have a case of arthritis that started slowly after the patient had had a fall and had injured the ankle. And then the arthritis process speeded up. So again, a long-term history. The patient's come with pain for the last 4-5 months, but has had a history of injury to that joint maybe 8-9 months back or a year back. It could trigger off the process of osteoarthritis further. So it's not always degenerative because of age. It could be induced by an infection or an injury. So, what does a joint, like you saw the normal joint, right? Now compare that picture to this. This is what an osteoarthritis joint looks like. See, can you see that the cartilage, which was it was all around the bone, has now started thinning because there's a degeneration. What happens? The joint space reduces, and this is what we will see on an X-ray. You cannot see the cartilage on an X-ray. You can see that the space between the joint has reduced. And how would that be? Because the cartilage has worn off and the bones are closer to each other. The synovial membrane gets thickened and these bones here become roughened because of the thinning of the cartilage, and you'll develop something which is called spores. Can you see? In the previous picture, it was a rounded picture here. And now you have a bony spur. This is also identifiable on a simple X-ray of the joint. I mean, an MRI would be more advanced and tell you more about the damage. But if you just get a simple X-ray of the joint, you can identify the reduction in the joint space, and also you can identify the bony spurs, which are also called osteophytes. Okay, now let's go to the second most common form of arthritis, which is rheumatoid arthritis. Very, very prevalent. One of the most, I think, highest ranking autoimmune disorders that we have. What happens in rheumatoid arthritis? See, here the body's own immune system starts attacking the person's joint, and not just the joint capsule, and that the whole capsule becomes like a tough membrane enclosing the joint, and slowly the lining becomes inflamed, and the disease process finally destroys the joint and the cartilage. And this is a more destructive, and that's why more irreversible in nature. But the primary cause is autoimmune. And homeopathy does beautifully in all forms of autoimmune disorders. Autoimmune is not explainable. We don't know why our body suddenly decides to go against itself. And there is very often a state in the patient that is causing the problem. I will be doing a case of rheumatoid arthritis with you to make it more clear that why rheumatoid arthritis requires a constitutional homeopathic prescription to basically heal the cause that is causing the problem. And this is what a rheumatoid arthritis joint looks like. Compare the pictures. Now you see there's a lot of destructive process that has happened. Of course, there is thinning of the cartilage, and then the joint space also reduces. But more so, what you will see is you'll see erosion of the bone. The whole synovial cavity is thickened. There's inflammation and spreads all over. The ligaments are thickened. The bones are eroded. So it's far more destructive of pathology. And because it has no reasons to cause it, and a very, very strong reason is the autoimmune disorder, body working against itself, it does beautifully with homeopathy. See, it takes time, it doesn't settle, but sometimes you may need to give them an acute prescription to allay the pain for that time if it is too much. But in this condition, you need to get to the state of the patient. You need to understand what is the constitution of the patient, how this problem started. Was there an ailment from something that was emotionally triggering this problem? Very, very often you will find out the causative factor, and you can take it from there and complete a nice homeopathic constitutional prescription that leads to a long-term relief in rheumatoid arthritis. So I would really, really urge that understand this kind of arthritis and treat it. They respond very well to homeopathy. Third, this is how you will see there is deformity in the joints also that happens in rheumatoid, because there is destruction of the joints. You will also see crooked fingers, not just the spores, the inflammation, but you will also see deformities that happen. So very often, people with rheumatoids will have, funny shape fingers. That's also a clinical diagnosis. It's happening for a long time, and slowly and steadily the fingers become crooked, and there is a lot of deformity. Third form, it's underrated, but I have seen a lot of cases of ankylosing spondylitis. And again, they also respond beautifully with homeopathy. It's an inflammatory disease. And this, basically affects some small joints of the spine. It affects other joints also, but primarily starts at the small joints of the spine, that is the vertebrae. And what happens here in ankylosing is because the joints fuse, they become less flexible and there is less movement. And very often you'll see that hunchback posture that a patient develops. Sometimes the ribs also can be affected, and that can cause difficulty in breathing. I have another patient wherein it's like a systemic, all the joints are affected. The knee joints are affected and the knee is fused, and that patient is not able to straighten the knee. He works on his toes. So these are deformities that happen structurally to the joint. And if we have caught it early, we can prevent, because once these physical deformities happens, difficult to reverse the physical deformity. So if you're able to catch an ankylosing earlier, it's very, very good. So like I had another case of a patient who had recently started joint pains, and because we have been treating a lot of ankylosing, I got her investigation and her HLA-B27 was positive. And that is one problem that happens, that very often there is a genetic element in ankylosing, which I'll explain further. What happens in this is, this is like how a healthy spine looks like. You see the vertebral column, you see the intervertebral spaces, they are all enough space between the two vertebrae. You see these are the nerves that are coming out of the vertebrae, because the spinal cord runs behind here. And then when this happens, when there is destruction here and inflammation and the joints start fusing, a normal spine curvature leads to a hunched back curvature. So we know in ankylosing, there are certain genetic factors that are involved. And there is a gene called the HLA-B27. Very important to get this. If you have a case, you're suspecting ankylosing, if it's early, you start treatment early. Get this gene. It's not that all patients with this gene, HLA-B27, will get ankylosing, but all patients who are positive, who have the symptoms, who developed ankylosing, you will find this gene in them. So it is very, very important that you get the investigations done and catch it early before the debilitating deformities have incurred. And finally, I'll talk to you about gout. So gout is again something that these cases come to us a lot, and why it happens and what are the investigations you require to do in gout. And here, very important on what is the guideline or the diet that you need to prescribe in gout is very essential, along with your homeopathic prescription. Because what happens in gout is there is too much uric acid in the bloodstream, and it is because of the accumulation of urate crystals in the tissues of the bodies. Now, what generally happens is if you take certain kind of proteins, which are called purines, that's a byproduct of the breakdown of purines is basically uric acid. And when our body is not able to excrete that, then these uric acid crystals start depositing in different parts of our joints, leading to the symptomatology of an inflammation, where there's pain, there's redness, there's heat, there's swelling. So this is primarily, a metabolic disorder where your body is breaking down the proteins. The proteins they form into uric acid crystals and they are not excreted out of our body. So what happens? This is how you will generally see a joint with gout, and it affects the ball of the great toe most times. The base of the great toe. It's like these are the urate crystals that are deposited, and this is how the patient, looks. It looks like a bunion, but it is primarily a condition of gout. Again, the investigations for this is not just an X-ray, but you do the serum uric acid levels in the body, and you will see that the uric acid levels are high. Why does the uric acid level rise? There are certain trigger foods for uric acid or gout attacks, and these trigger foods are very high in purines. So when you digest the purines, your body makes uric acid as a waste, and people with gout cannot remove this uric acid. And that leads to the accumulation of the urate crystals, and the gout attack happens. So it is very important, if the patient is of gout, that along with your treatment, there is, what we call a diet that you will prescribe. So I'm going to talk to you what are the foods that are to be avoided in gout. And, you can mark this in capitals. Alcohol. Alcohol is the major trigger for a gout attack, especially beer. Beer is very high in purines. I have seen patients who have gout and they've had one glass of beer, and the next day or that night, very often the pains are aggravated at night. That night they come up with a gout attack, and ask a patient who's had a gout attack. I mean, it's very, very severe pain, and you don't know what to do at that time. It's like a very irritating and a very severe pain. Certain seafoods like shellfish can cause gout. Red meat, most all red meat should be avoided. Like, we've had an orthopedic doctor in our, professor circle. Like, we've trained with him in our college days, and I'm still in touch with him. And, whenever I send a patient to him for an opinion, and I will very often in the file see this one yellow page that comes up, where he will always put up, if the patient has gout, the do's and don'ts about the diet in gout, which is very essential. So red meat in all forms should be avoided. Alcohol should be avoided. Lean meat like chicken occasionally is okay. Beans and peas in our vegetarian sources are, and some leafy vegetables also are not good. They are high in purine. Sugar, some sugars that are present in sodas, some juices, ice creams also are the foods to be avoided in gout. Very, very, they are very detrimental. They can trigger off an attack. So then what do you eat? You eat everything else other than what are the no foods. So you can eat all forms of fruits. Fruits are fine for gout. In fact, cherries are supposed to lower the uric acid levels and reduce the inflammation. All vegetables are good. But you can avoid potatoes, peas, mushrooms, eggplants, and dark green leafy vegetables. Other than that, have all vegetables. All nuts and seeds are good. All whole grains are good, but especially oats, brown rice, barley are good low purine foods. Dairy foods are also all allowed in gout, but preferably the low fat dairy is good for gout. You can have eggs, so that's okay to have in gout, and all beverages are also okay to have, like coffee, tea, and green tea, not sodas and ice creams and shakes. Those are the foods. So primarily, you need to know, along with your prescription, what else are you going to do? You take the history, you take the whole symptomatology, you examine the patient, you investigate the patient, you treat the patient and make a prescription. And along with that, also tell them what are the other things they can do. So let's talk about now homeopathic therapeutics for joint pains. What are the remedies that we can use for joint pains? So there are, as I spoke initially, two methods to prescribe: constitutional prescription and an acute prescription, and both are very good and vital. So you have to see what the patient needs. If the patient has come with a history of fall half an hour back, you will not take a constitutional case. You will take an acute history and prescribe accordingly. So now there could be many reasons. The patient can have a bursitis, the patient can have a tennis elbow, the patients come with cervical spondylosis, or an acute back pain after lifting some heavy weight, or the patient has reached out to pick up a heavy basket from the top shelf and has suddenly come up with a back pain. There can be many reasons for an acute prescription. So now, whatever your cause is, we have a huge number of homeopathic remedies which will help the condition. But I cannot say take X medicine for frozen shoulder, take Y medicine for a tennis elbow, take Z medicine for the back. No, you have to, even in an acute prescription, match the symptom similarity to what is happening in the patient to what is there in our remedy. So I'm going to run you through a few remedies which have really, really helped me in my practice. Again, I am saying this is not that this is all that helps. There are far more. You have a huge materia medica, you have a huge repertory. Please use. I am sharing my clinical practice, that what are the things that have helped me make an acute prescription. And I see the symptom similarity and prescribe. So take it as it comes, and you are welcome to take it forward, learn, and improve your knowledge ahead. So some of the remedies that I have used for acute prescriptions are arnica, rustox, ruta, redempal, magphos, symphytum, eupatorium, rhododendron, actis picata, colocynth, semicifuga, and colchicum, and many, many more actually. But today, I'm going to share with you some of the tips that I have used when I see a person coming with a simple joint pain. What do? I take an acute totality and see what are the symptoms that match. So if you you just read those ones that I have bold faced in my presentation, I think that is also great. There are a lot of symptoms to the remedies, but you need to see that this is where the sphere of action would be. This would be the kind of pain that the person will come. Arnica montana. Arnica is like a remedy that every single patient of mine has in their house, and especially if they have children. Because why? Arnica, mean whether I have told them or not, they already know that it's the best injury remedy after any injury with blunt instruments. So where there is no laceration that has happened. So either the patient has banged, the patient has fallen, something has fallen on them, any kind of injury where it has not opened up, the wound has not opened up, and it's a deep injury. And that's why you will see best injury remedy without laceration. You see it has effect on its blood vessel and can cause those blue black spots that we call, in Hindi we call neel pad gaya hai, and that's called ecchymosis in medical terminology. So it can be wherever, when there is injury to the organs inside without the skin having broken. And what is the sensation that you will feel? It's a bruised feeling, it's a sore, lame, bruised feeling, and it is there all of the body. The patient can't even walk on account of the bruised feeling. Now, these are again some very important symptoms when you're prescribing arnica. The patient, whatever he lies on, seems very hard, and he's always wanting or looking for a soft place to be, because that's the kind of experience he has, that everything is too hard. They're extremely sensitive patients. Even in chronic conditions, and we are prescribing arnica, like gout and rheumatism, you will see that the patient is having great fear of being touched by persons coming near to him. If you'll see it in the sensation route, arnica falls in the compositae family, where there is ailments from injury and a great fear of being approached. So they don't like to be touched. They don't want, they'll tell their doctor, nothing is wrong with me, doctor, I'm fine. Primarily because they don't want to be touched. So they don't complain too much, arnica patients, because they have fear of being approached. It's a very good remedy for writer's cramp, overuse of the fingers, and you'll have the writer's cramp. Also, it is very good for bursitis. I said an acute condition, pre-patella bursitis. So it's called hygroma patella, where there is inflammation of the bursa that is overlining the patella bone in our knee joint. And this very often happens because of trauma. So like, what can be the trauma? That let's say the child has been playing and he falls down on his knee. That could be a trauma that could lead to the bursa that has got inflamed. Or, very often a continuous gradual slow injury to the joint. Like, I had a maid who has complained of swollen knees, and there was a lot of pain, and I could not make out what it is. But then I realized when she mops the floor, she is constantly the knees are constantly hitting against the floor. So different maids have different forms of methods of mopping. She was constantly hitting the floor when she was mopping. And then I thought, this could be bursitis, and accordingly treated her. So, again, history, examination, very important. And then you match the symptoms. So arnica is a very good remedy for bursitis because of injury. Let's go to the next remedy. I think, an orthopedician's delight, toxicodendron, or we commonly call it rustox. So I think is the most overused remedy in homeopathy because of the wonderful effects, in helping the patient that we see with this remedy. So now, what are the causative factors when we have to prescribe rust stocks? Now, it could be for any of the diagnoses, but if there is ailments from spraining or straining a single part, like, I told you, somebody reaches out to pick up something from the top shelf or has bent down and then has got a crick in the back. And, it's like straining or spraining a single part. Also, second is getting wet after being overheated. Very often, I had read somewhere about rust dogs, fever after getting, bathing in the lake or the river. And I never could make out who goes and bathes in the lake and the river these days. But, once all of us doctor friends, our fellowship group had gone for a picnic, and we all jumped into the the lake, and we were in the lake for half an hour or 45 minutes and, enjoying the water. And the next day, 5 of the 8 of us had fever, and we all responded beautifully to rust dogs. So getting wet after being overheated is a causative factor. Spraining, straining a single part or a muscle is a causative factor. Overlifting is a causative factor. And then now this could be the causative factor. So what is the presentation? All pains of rust dogs are aggravated in the first motion and better by continuous motion. I mean, everybody knows this. I'm just kind of, putting it down again in front of you. So the lameness, stiffness, the moment you wake up in the mornings, when your body is rested, the first movement, pain starts. And then when you move a few steps and your body gets warmed back again, then the pain settles down. You cannot forget the restlessness and the anxiety of rust dogs. Now, rust dogs comes from the Anacardiaceae family of, the plant kingdom. And there is a lot of restlessness. There is a feeling of being stuck, of being strained, and that you will see it in the physical and the emotional symptoms of rust dogs. They cannot remain in the bed for a long time. They're constantly changing positions to obtain relief. So aggravated by rest and better by continuous motion. Another feeling, I remember a case, we had very little time, and I was with Dr. Shankaran, and we were with a patient, and then suddenly somebody, just walked in and said, doctor, I've had this very, very bad backache, and, suddenly it has started. I was trying to lift something and it started. And he just asked, have you used any hot or cold on it? Oh yeah, I did the hot fermentation and I felt so much better. Doctor, can you tell me what I can do? And he said, okay, give her rust dogs. So ailments from straining, better by warmth. Stiffness when on rest, and better by motion. Some of our totality symptoms for rust dogs. Also, we see there is rheumatism of cold season. So if you're in chronic cases, you will see that the cold weather aggravates rust dogs patients, and we'll have remedies for the warm season as well. As we come, I'll talk to you about it. Let's go to the third remedy. Again, very, very essential remedy in our materia medica for joint pains, Ruta. So this is again an injury remedy, but there is injury to the bones and the periosteum, the covering of the bones. Also, there are complaints of tendons. So, when we diagnose something like tendinitis, especially the flexor tendons, and the tendons get sore, Ruta is an excellent remedy. Pain in the tendoachilles, I think Ruta does the best there. We see that there is a tendency in Ruta for deposits in the periosteum, in the tendons, and about the joints. And especially, very good for the ganglions in the wrist. So wrist joint ganglions. Easy sprains. It could be of the ankles or of the wrist joints. And a bruised limb sensation all over. Rutas, also given for ascending symptoms, that, everything that starts from the bottom and comes above. So paralytic weakness of the legs after spraining of back. The knees can feel as if they give way. The sciatic pain is there in Ruta, which can be worse from lying down. It's usually at night, when the patient goes to rest and saying, I just cannot sleep because of the backache. So Ruta is given in many conditions, but you need to understand that the sphere of action of Ruta is primarily the bones, the periosteum, and also the tendons. So Ruta also is used to complete certain cures. Like we know arnica is good for injury, so is Ruta. So after injury, it actually hastens up the curative process in the joints. And even after symphytum, when there's injury to the bones, Ruta is very helpful. So, this is a very good remedy relationship that you can see. Remedy relationship given very well in Allen's. So, I use that remedy relationship very often in acute prescriptions. So, very often Ruta has been used after arnica or symphytum to complete the curative process in the joints. Right? Let's go to the fourth very important remedy, our gout remedy, Ledum pal. It's a rheumatic remedy with a gouty diathesis, and of course, constitution's abuse by alcohol. Can you see the relationship? In gout, alcohol aggravates the most. In rheumatism, which has a gouty diathesis, the constitutions are abused by alcohol. The rheumatism begins in the lower limbs and ascends upwards. The joints again become the seats of nodosities, like the gout stones. When I'd shown you that picture of gout, you'll see the great toe swollen. So the ball of the great toe swollen and painful. A typical picture of gout is seen in Ledum pal. We also have affections of the left shoulder and the right hip joint. There is easy spraining of the ankles. Heels are sore and painful. They can hardly step on them. Again, now the pathology could be anything. It could be a calcaneal heel spur. It could be a gouty deposit in the heel. So you see the symptom similarity and prescribe. But one main thing is with Ledum, the patient is always chilly. Always. Affected parts are cold to touch. And yet they are averse to external warmth. So chilly, but does not want warmth. I think this is a keynote for Ledum pal, and you must remember this, that in whatever condition, whether it is rheumatism, whether it is gout, whether it's a sprain, the patient is chilly, the part is cold to touch, but they do not want the external warmth. It's very good for frozen shoulders also. There is pain in the shoulder on raising the arm. So this is a very, very good remedy for that as well. But again, match the symptom similarity and the modalities. Bogus synoptic key, it says much uric acid sand in the urine. So confirming that Ledum pal is a very good remedy for gout. So, I think, don't read Materia Medica from one book, read it from many. And then, if you have a lot of patients, sometimes go back and see, okay, the patient got better, then check the symptom similarity and check our Materia Medica. I think learning in homeopathy kind of enhances as age advances, because if you study back some of your treated cases also, you will realize, oh God, there are so many other parts of the remedy that I did not know. Let's go to the next remedy. This remedy, Magphos. Very often we know about Magphos used for uterine cramps, for period pain, dysmenorrhea, and very, very odd, colics in the abdomen. Magphos is very, 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 very commonly prescribed. But, friends, I'll tell you, Magphos is superb for joint pains as well. Again, what kind of pain? Magphos is there for this very violent paroxysmal pain, like a neuralgic pain. We know of it as an antispasmodic remedy, but it influences not just the nerves, but also the muscles. So sharp, shooting, lightning-like pains, you can give Magphos. It helps the patient immediately. It's wonderful. It's lesser used Magphos in joint pains, but if the pains are sharp, shooting, like lightning, changes places, better by warmth, I think it's a super prescription. There is cramping of the muscles. Again, it is for, the writer's clamp, or anybody who's using, like nowadays we use the laptop a lot, and if we are using the fingers a lot, there's a lot of cramping. Magfos helps in that. And this, again, like Rustox, is helped by warmth, and there is great dread of cold air or uncovering. So do use this remedy for this kind of pains, not just for dysmenorrhea. It's very good for joint pains as well. Symphytum. We all know about Symphytum. It's a superb remedy for the bones. It's called, the common name is knit bone. You know why? Why would it be called knit bone? Because it helps with injuries of the cartilage, the periosteum. So even fractured bones which have not healed well, Symphytum very beautifully, favors the production of callus, and the bones that have not healed, it helps union of fractured bones. So I think this remedy is very, very commonly used. So I'm not really spending too much time on this. Let's go to Eupatorium perfoliatum. Now, in our current conditions also, Eupatorium, by current means I'm talking about our COVID situation right now, which is pandemic, and a lot of patients have been helped by this remedy, Eupatorium perfoliatum. Not just does it help in the fever, it has fever with bone breaking pains, with that complete, the malaise and the tiredness and the immense pain in each and every. The patient will say, "Meri haddiyan dukh rahi hain." That's the kind of that the symptom the patient comes up with, because the leading characteristic is violent aching, bone breaking pains. It's also called bone set, and relieves the pain in limbs and muscles that are accompanied in the some forms of febrile diseases, like our materia medica writes malaria, influenza, but we have seen Eupatorium very well for dengue, for coronavirus, even chikungunya, wherein the febrile illnesses and the bone pains are together. So I think use this remedy. It really works very well. We also have an affinity for the great toe and gouty deposits in the great toe. That means just like how we have seen in other remedies, this is a gouty remedy. There is inflammation and nodosities of joints associated with headache. Again, you'll have a bruised feeling as if everything is broken in the body, like arnica. And the kind of the pain and the malaise that we are seeing in COVID, Eupatorium is doing very well. Rhododendron. Like Rustox has rheumatism of cold weather, on the other hand, rhododendron has rheumatism of hot weather. And they're very, very sensitive to windy or stormy wet weather. They in fact come to know that now they will have an attack of joint pain because there has been a thunderstorm, because there has been a lot of breeze. They are worse before that, the huge, the winds that come before our thunderstorm, the lightning that happens. So it's a very good remedy for that. Again, we'll have gout inflammation of the great toe. It's very good for gout, and it has wandering pain, which shifts from one joint to the other and are severe at night. So rhododendron, I think what you need to remember is the hot weather, rheumatism aggravated by windy or stormy weather. They can predict the joint pain coming in because of the storm. So very, very good remedy for the joint pain. This remedy has helped me a lot at times. This is a remedy for the small joint pains, the finger joints, the ankles, the toes. And the main thing about Actis piccata is that the swelling in the joints start from slightest fatigue. So any kind of overuse of the joint and you're tired, that will trigger off the pains in the small joints. You'll see that there is swelling. Either any finger joint can be swollen. Either the patient will talk about this joint here, sometimes here. There is swelling in the joint, and it is worse from any motion or touch. Symptoms also, of course, it can have a systemic cause also. That also can arise from fright. So again, you could take that aspect, but very, very often I have prescribed them. Sometimes when I'm just not able to relieve the patient in their arthritis and they have coming up from these small joint pains, it helps me as an acute prescription. Colosynth. Colosynth is our antispasmodic. Again, we have used Colosynth for a lot of, like Magforce, for a lot of cramps in the abdomen, which is better by bending double, but it is also very good for joint complaints and especially nerve pains. And it, all our nerves like the trifacial or the sciatic nerve and the spinal nerves leading to sciatica. Colosynth is very, very good. You will see primarily the sciatic pains on the left side of the body, and it is better by pressure and heat. So, when if the patient feels good lying on the back and has had a heating pad below, that is, they'll tell us the best thing for me to do is to put a heating pad and lie down in the bed. So what is happening? The pressure is helping and the heat is helping. So that is Colosynth. The patient will lie on the affected side. Why? Because pressure helps. There's also rheumatism of the right deltoid, and there can be pain under the right scapula, which is also better by pressure. So better by pressure, better by heat, affection of the nerves, especially the sciatic nerves, Colosynth. Simicifuga, or Actia racemosa as it is called. Very good for severe pains of the neck muscles and the back muscles. So the spine is sensitive, and the pains occur because of wrong posture. What is cervical spondylitis? Cervical spondylitis is an arthritic osteoarthritis of the cervical bones. It's the same thing. There's degeneration of the cartilage, the joint space reduces, and there is a pain because of the nerves getting caught. And this is very postural also. So anything like, using the laptop a lot nowadays. Amatida Medica says sewing, typewriting, piano playing. So right now, I think what we do most is we are sitting like this and we're working on a laptop all the time. That can cause a lot of spinal issues and sensitivity. And Simicifuga is a wonderful, wonderful remedy for that. Again, it is very underused. I will suggest use this. It affects the bellies, the rheumatism affecting the bellies of the muscles, like large muscle rheumatism, and very good for stiffness of tendoachilles. Colchicum, finally. Again, very, very good. Again, as colchicine, as we know, is used for gout. The same inflammation of the great toe, gout and heel is marked indication for colchicum. They cannot bear to have themselves touched or moved. So the joint is swollen, red hot and stiff, and they cannot bear anybody to touch it. Even like stubbing the toe can be very, 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 very painful for them. So again, a very, very good remedy for gout. So as much as all these acute medicines, the ones that I have discussed now, and there are many, many more, like you can use bryonia and so many other remedies that are good. They will give you good symptomatic relief. But if the condition is a condition of long-standing chronic ailment, a well-selected constitutional homeopathic medicine always works better than chronic joint pains. So this much for now for acute pains. I'm going to stop sharing. And if anybody has any questions, we'll speak about it for another 5 minutes. And then I'll go to my chronic cases and how a chronic prescription, a constitutional prescription, helps a case of chronic joint pain. So I'm going to open up the chat box if anybody wants to ask something right now.
Those who have doubts, please write it in the chat. Dr. Indu, please see the YouTube live also if there are questions in it.
There is no questions. I think we can move on. Then at the end we will ask.
May I ask one question before we move?
Sure, please.
Yeah.
Ma'am, when there is no pain but just stiffness, like the finger is when we can clasp it but difficult to open it. If there is a stiffness like of the finger that it cannot be opened up, but there is no pain in it. Such type of thing which comes under what and how we can cure it.
I think what you're talking about is trigger finger, if I'm not
Yes,
mistaken.
madam. Yes, trigger finger of middle finger or ring finger, like that. More than usually we see with the thumb, no? When it comes to different finger, how it is.
Yes. So see, now I'm going to explain what trigger finger is. So trigger finger, basically it is an inflammation of the tendons. Again, it is a tendinitis. All right. So the tendons, that is the end of the muscle that is connecting to the bone, basically becomes inflamed. Very often it is seen in chronic inflammatory conditions like rheumatoid arthritis or in diabetes. A lot of patients with diabetes would come up with trigger fingers. And what happens is, usually what happens, let's say the ring finger, it bends like this, and then there is difficulty in opening. They are not able to open because the tendon is now inflamed and is not doing the function. So if the ring finger turns like this, you can open it. You will slowly, when you open it, it goes like a tuck. That is what is a trigger finger. It can happen in the thumb, it can happen in the ring finger or the middle finger. So any of the fingers actually it can happen, but very commonly we have seen it in these three fingers. So again, you will treat it like, if you have a systemic cause, then you will treat the cause. Otherwise, you will treat according to the symptom similarity. And along with that, you can do certain exercises, physiotherapy. This tendon here needs to be massaged clockwise, anti-clockwise, which will also relieve it. So the remedies with symptom similarity here also will be prescribed to treat the trigger finger. But if it's a chronic debilitating disorder, there is kind of rheumatism or diabetes, I think a chronic case taking and a chronic prescription is better for it, right?
Thank you, madam. Thank you very much.
Okay. Any other question? So see, again, what I understand is like the pathology is very important. So you need to understand if the pain is coming for certain reason, you have to understand what is the clinical symptomatology, what is the pathology behind, what investigations you would want to carry out to kind of determine and then treat accordingly. So if I knew the pathology here is tendinitis, then I treat accordingly. If I know that it is a systemic ailment that is causing the problem, then I treat accordingly, right? So, you cannot undermine the what you have learned in college. You must kind of keep reading more and more about illnesses. And it's good, sometimes our patients are our best teachers also. So our process of learning is an ongoing process. So it just continues, yeah? So good. Now
Yes, ma'am, there is another.
There's another question.
One more doubt. Yeah. How to go about a cases of rheumatoid arthritis prognosis? What result to expect? How much time to wait for titer to come normal? By Dr. Hital Mehta.
All right. So I'm going to do a case of rheumatoid arthritis right now. It means I'm going to do two cases of systemic disorder. So I will answer this question after you've seen that case. Yeah. So it's a very, very valid question. And I think it'll get answered while the case is on. What else? Anything else?
There are many questions, ma'am. I think we can ask that after the cases. Okay.
So I am going to now go through the next case. Give me a moment. I'm going to stop share. Now see, this is a case of Kienbock's disease, which is the avascular necrosis of the lunate bone. What is the lunate bone? See, we have our 8 carpal bones here, and lunate bone is one of our carpal bones. So it is more on the radial side of the wrist joint. So now the name sounds very fancy, but now let's just go through the whole case. The patient came to me with an established diagnosis, and the condition was there for 4 years almost, and had actually practically tried everything, including, I think, steroids and severe painkillers, and nothing was really helping her. So this was an online consult that I had. So I'm going to go through and see. This was a complete constitutional prescription, and it was done with our, classical homeopathy, what we've learned in college. So I wanted to show you one case with a classical method, another case with the sensation method, because you don't know which method to use till the time the patient is in front of you, and the patient guides you which case to prescribe, what remedy, and what do you expect. So let's hear. What is Kienbock's disease? Kienbock's disease is an avascular necrosis of the lunate bone. So lunate is one amongst the 8 bones of the wrist. In this condition, the lunate bone loses its blood supply, and it leads to the death of the bone. So it doesn't lead to the death of the bone immediately. So the process starts where the blood supply reduces. The changes are there is severe pain of this joint, swelling and tenderness in the joint and the overlining tissues, and you lose the ability to use this joint. As in, like, what is this joint used for? Everything. You use it for lifting, use it for writing, you use it for grasping. It's a very, very important joint, although it's a tiny joint, but it has multiple uses, and this patient actually came with a lot of trouble. So I'm going to tell you what the chief complaint was. She's a 36-year-old female. I took her case on 6th of Feb last year, and she doesn't stay in India, but I did not have a method that time because of the lockdown that was happening to send her the medicines, although the case was seen. But I could finally courier her the medicines in September 2020. And what was her symptomatology? There was pain in the wrist. So, this patient came with a lot of symptoms locally. So there was pain in the wrist, and it was more on the side of the thumb, and it started since 4 years. The main complaint was there was so much stiffness and the swelling of the joint, and it was triggered by the slightest movement. And how do you do kind of avoid slight movements of the wrist joint? It's so much used, this joint. And she stays in a very cold country. So she says every winter, so when I saw her in February last year, she's saying the winter was massive and the cold weather is a killer for me. So, I could see that there was movement which was aggravating, that it was cold weather that was aggravating. And she says, I can't do the basics. She has 2 kids, and one is really small, and abroad you don't have any help. So she says small things like rotating my wrist, kneading the dough, then I have to, kind of turn things when I'm cooking. Even a small stir is impossible for me to do. The pain is so much that it is hampering my life. I can't put any pressure on my wrist. So it was aggravated by movement and exertion. And her grip test, she could not pick anything more than 2 kilos. And she says, here we have to go to the supermarket and buy things. And I am not able to lift anything. And there was she was very, very put off. Just imagine not being able to do simple basic things. So we had a lot of modalities that came up in the physical sphere. So I asked her, how is the problem making you feel? So since this was not like an acute problem of 2, 3, 4 days, I could have prescribed on just the symptom similarity, but it would have given her a short-term relief. The pain wasn't for last 5 days, 7 days, or 10 days. The pain was long-standing. There was a deep chronic pathology of avascular necrosis. So I had to go deeper into the case. But you can take the patient as much deep as they can. You can't take the patient completely. So this case, I took the mind, but I could not really reach too deep in the case because that was the level of the patient. The patient was on the emotional level. So it was very difficult to go too much. But I got a lot of symptoms on the emotional level. So let's hear what were there. She says, I'm very angry and irritated these days. I shout at small things. I cry for little reasons. In this corona situation, I can't go out. Earlier we used to go for long drives and I can't go. I can't take the kids out. And that was irritating her a lot. So I asked her about the problems. She took me to, the irritation that she was getting. It was because of the pain, but she also said because she was restricted in the house and her desire is to go out, to move out, to take the kids out, to go for long drives, to meet her friends. I really like to socialize. I meet people, go on long drives. She was very fond of driving herself. She's saying, I'm getting too angry and I don't like myself. I'm shouting and screaming at my husband and my kids. And all this happens before my periods. My hormones really play up and I'm very, very angry. So I said, what are the things that make you angry? She says, when I'm ignored, I feel very emotional. I feel very sidelined. Deep inside, I feel I have done something wrong and this is happening. She describes an incident with her friends. For her friends are very important. She says, here, our friends are our family. When we are living abroad, we don't have family. Friends are our circle, our inner circle. And something happened where she felt emotionally ignored by her set of friends. And this kind of made her feel horrible that, she was sidelined. But internally, she felt, I think I only must have done something wrong that this is happening to me. So then I wanted to understand because I saw so many, there was a lot of symptoms about anger and irritation and everything on the emotional level. I tried to go deeper. I said, tell me, how were you as a child? Primarily to get the uncompensated state of the person. She says, I was very attached to my mother. I seeked her attention all the time. If mother did not spend time with me, I would be very annoyed. I was in the top 10 of the class and I always wanted the attention of the teacher. And I love dogs. I said, why did you love dogs? She's saying, I love the way that the dog loves you and gives you the affection. They are loyal, they're lovable. They like to be loved and they love back in return. And I am just like that. I didn't even ask her that. So when she was describing the dog, so what, should I give her lac caninum because of her love of dogs and like her natures of like a dog? No. What she's trying to tell us here is that I want to be loved. I want affection. I want to be cared for. And I also revert back and I give back that love just like a dog. If you will go and see, she wants to be with friends. And so she sees, oh, did I do something wrong that they are not including me? I want to be the best in my class. I want my teacher's attention. I want my mother to spend a lot of time. I want her affection. So for her, attention and affection are synonymous. She basically needs a lot of love and affection. I said, what are the things that make you happy? She said, meeting friends, going out, going for drives, spending time with my children. I love listening to music. I love driving a lot. So these are the things that make you happy. Again, everything on the emotional sphere. So what are the characteristics of this case? This was the case. What am I going to prescribe on? So I couldn't, and I didn't want to kind of, this was a very deep-seated case. I had to give her medicine for 6 months. I can't see her every 15 days and, change my prescriptions. So I had to be very, very sure. And, Dr. Shankaran always says, just take what is there in the case. So whatever is sure, you need to take that. So there was a lot of local symptoms, lot of modalities of the pathology. And the mind state was on the emotional level. Nothing was so deep. So I had to pick up, whatever was characteristic in the case, like our constitutional prescription, like, what we call the classical homeopathy. So these, I took some of the local symptoms, that there should be an affinity for necrosis. The remedy should have. That's the pathology here. The wrist pain is definitely aggravated by motion. I mean, actually, if you go to see, there are only 3 remedies for wrist pains that are aggravated by motion. There was swelling on motion. I was like, wow, there are only 3 remedies for you seeing wrist swelling. There was stiffness of the wrist. And it was after the joints became cold, the cold weather aggravation. And I was like, there is only one remedy here. I was like, what is happening? Let me see further. The pain in the wrist extended to the fingers, and it was on the outer radial side. So again, I took extremity pains, hands, outer radial. We have a rubric like this. And there was pain in the hands on grasping things, and the swelling was painful. So I got a lot of local symptoms, and some of them had very few remedies, so I thought that I'm coming closer, and then I still took all that was available in the mind, affection, response to, and returns. Ailments from being neglected, delusion, she feels she has done wrong, very attached to mother, easily irritability before menses, irritability during pain, and desires to drive a car. And she also had in her generalities a fondness for eating chicken, and winter weather aggravates. So this was my whole mind and body. So I took the mental generals, particulars, the physical generals like your cravings and aversions, your cold weather aggravation, and I took the physical particulars, and I made a constitutional totality. And it was amazing to see when I repertorized the wrist totality, phosphorus rose amongst the highest. And phosphorus had swelling of the wrists on motion, and there were only two other remedies. And phosphorus had joint that became cold that aggravated. And also wrist movements aggravation. So phosphorus covered all her physical pathology. So there's a deep pathology, and it is also written in the books for necrosis of the bone. So it was, I think, necrosis of the tibia that was there, but in generalities, in the extremities also, there is necrosis as a underlying pathology. I was like, wow. And when I did the mental repertorization, yes, this patient was like a phosphorus who loves affection, who returns affection easily, who does not want to be neglected, who wants to be with the friends all the time, who loves and enjoys company, and also has a strong desire for chicken, and winter aggravates. So when I put both of this together, I came to the remedy phosphorus. But you know how I am? I don't go by the repertory alone. I like to go back to my materia medica and see whether this kind of coincides. So I always take the repertory as a tool and then go back to my source books. So I went to Allen's Encyclopedia to read phosphorus and the upper limbs and the wrist. And you know what was written? Swelling of the wrist with throbbing in it as if there's an ulcer, with tearing extending into the fingers, even during rest, and still worse on moving the wrist that was stiff after taking cold. So, in just 3 lines, Allen's writes that it is after taking cold, moving the wrist, aggravated dress, and swelling of the wrist, which was extending to the fingers, and throbbing pain as if there is an ulcer. I was like, how wonderful is our materia medica? Exact pathology is described. Also, then I went to Boric, which is also a book I refer to very often for the generalities and specifics. So in the extremities, there was mention, can scarcely hold anything with his hands. The tibia is inflamed and becomes necrosed. So there was necrosis in the pathology. Arms and hands become numb. So we saw in this prescription that there was a pathological prescription, plus we took into the mind, plus we took into the local modalities, and we made a prescription. And what I gave her was phosphorus 200 and LM8. Lots of people have questions on potency, and I'll tell you how I prescribe. Now, I wanted to give her something on a regular basis. I prescribe according to the levels of experience that I have learned from Dr. Shankaran. This case was on an emotional level, and that's why I needed to give phosphorus. But this was a progressive disorder. There was something that was happening on a regular basis. The blood supply was reducing to the lunate bone. The necrosis was happening, and it will further happen till the time the whole bone gets destroyed. So in a chronic pathology where I think I need to repeat more often and I will not be able to for fear of aggravation, that's the time what I've learned from Dr. Shankaran is to use the LM potency or the 50 millisiemen. So sorry, this is not LM8. I think it's a mistake. I'm going to correct it. It is LM6. Okay, so I gave her a phosphorus 200 and an LM6, the 50 millisiemen in the 6 potency on a daily basis. I spoke to her after almost 3.5 months of having started the treatment. And she says, Doctor, I am much, much better. And I'm so thankful to you. You know, I should have recorded. It was a telephonic conversation. She's saying, my pains are so much better. She says, Doctor, today I could make halwa. I know if you're an Indian, you know what is halwa. Halwa is where you have to turn your, if it's made from wheat or it's made from suji or a lot of things halwa is made for, but you have to constantly turn in that pan to kind of get the halwa rolling. And she says, earlier I could not turn the hand to even make a vegetable, and today I actually made halwa and my pains are much better, and I'm such a quiet, happy mood these days. I've become much more positive. You know, my husband and my children are noticing that I'm not getting so irritable and my moods have gotten better. The swelling in the hands is better. There's no stiffness. Right now we are in the peak of winter. Remember, she came to me in February 2020. She says that time it was winter, it was very bad, and right now again the winters have come in. It's the end of December, and last winter was very bad, and right now being in the peak of winter also, I'm so much better. She says, you cannot believe I can carry more weights. I can carry a full basket at the supermarket. So, this was a beautiful prescription that was made with a constitutional homeopathic remedy, which helped physically and emotionally. And we saw, her symptoms subsiding and her life coming back to order. So in such cases, I think it is very good to make a constitutional prescription. All right. Now I'll go to another case, which is another systemic infection, that is rheumatoid arthritis. And then we'll take question answers at the end, because we are almost 1 hour, 15 minutes, another 15 minutes and I should be done. And then we'll do a short question answer session. Okay. Now this is a case of rheumatoid arthritis. So as I had spoken earlier in my presentation, rheumatoid arthritis is an autoimmune disorder wherein your own body does not recognize its own body parts as their own and starts attacking the joints. And it can begin in any joint and go to the other. There is inflammation of the synovial membranes and the synovial fluid, and finally it leads to severe destruction of the joint, and you will also see a lot of deformities in the joints, like I had shown you the picture of crooked fingers. All right, so let's see what was there in this case. Now this case was a deeper understanding of the mind, and I have done it with the sensation method. Okay, of course I take the repertory and materia medica, and I also see the kingdom root, so as Dr. Shankaran says, there is no one method to prescribe. You can prescribe by different methods. The patient will tell you which method you need to prescribe. So he is also not the one who prescribes one method. I have seen him use many, many methods. So this case required to use the sensation method. So see how it proceeds. Now, she is a female patient. I saw her in September of 2019. She's an old case. She had earlier come to me for some other problem many, many years back, and I had made a prescription. So I didn't even go to that case because she had come after 4 or 5 years. So I take it as a fresh case. I don't get prejudiced with what I had prescribed to her earlier, because I have grown as a homeopath. She has grown as a person. Her situations are different and her mind space is also different. So, I see what is there just now. So when she came in September 2019, these were her symptoms. She said she had right knee pain since 2 years. It was a throbbing pain. She says, I am unable to sit. It is worse at night. I'm not able to walk. She says, I love walking, but because of this pain, I'm now restricted. I'm not able to walk. What I like cold compressions on it. I feel better by cold. Also, I have started developing now a backache, which is very severe, and I'm not able to lie down in the night. So this is all that I got about her physical complaints. There was nothing more she could tell me. No, doctor, there is severe pains. But you know what, doctor, the pains are there. But can you see my hair? All the steroids I have taken for the pain has caused so much hair fall. See, doctor, you can see some bald patch here. See some bald patch over there. मैं तो टकली हो जाऊंगी, doctor. Do something. So now she is complaining of rheumatoid. She came with a diagnosis, and she came with her symptoms, but her energy was, doctor, look at my hair loss. Can you see how much hair I have lost? It's giving me sleepless nights. So, immediately from the physical, she went into her mind. This is wonderful for us. The physical state is the best place to understand what is going on in the mind. So, very often, this was my next question. What is the effect of the complaint on you? So I was like wanting to know, what is the rheumatoid arthritis doing to you? She says, I'm in depression right now. Not for my rheumatoid arthritis, but see, doctor, how my hair has become. I am balding. I'm looking ugly. And with all the steroids, see the amount of weight. You know how I used to look those days, and see how I look now. So she basically felt a lot disgust with her body. She's saying, I'm very upset by the way I'm looking, and I just don't like myself. So very soon from her physical, she jumped to her mind. Again, at the emotional level, she was not happy with the way she was looking. But it was very easy to take her deep. Let's see how. So I said, what is on your mind right now? So she said, see, doctor, I'm a very helpful person. You know me for so many years. I'm a very, very friendly person. And I have this one friend who is my chuddy buddy. You know what is a chuddy buddy? It's a slang to say that she is my heartthrob, my very, very close friend, and we have kind of grown together. She's saying she is my that friend. We have done everything together. Our first smoke we had together. Our first drink we had together. Even our first crush we had together, doctor. We've done everything. And I was very, very emotionally attached to her. She was like, I can't even say like a sister or a mother or something. She was like my soulmate. And I have been very, very attached to her for everything. She's always supported me and she's been very nice. But doctor, I couldn't see it, but she was constantly conspiring against me. I came to know of it. She betrayed me so badly. I felt I was badly used. I was let down and I was humiliated by her betrayal. She's saying, I was so humiliated, I could have jumped off a building. Wow. Now she has gone further down. So I needed to ask her, okay, tell me what is happening. She's saying, I get this betrayed feeling all the time. Right now, even my child is going through a major problem and I don't want to discuss the issue. Very often, sometimes our patients don't want to tell us what is happening. And Dr. Shankaran says, forget the story. Don't go into the story. The patient doesn't want, even we don't want to hear what is the problem that is happening. I said, okay, don't tell me what is happening. Tell me, what is your feeling in this situation with your son? That means you will come up with a delusion. You will come up with their experience of the situation. She's saying, I have faulted big time as a mother. I did not give my son the right advice, and today he's in shambles. I feel I have wronged so much, I deserve to be punished for it. I was like, what happened? 5 minutes back, she was talking about being betrayed by the person she is most closely attached to, someone who's almost like her family, who's let her down miserably. On the other hand, she says that I am feeling that it is my fault. I have done something really, really wrong, because of which my son is in trouble, and I've done so wrong that God is punishing me for it. So I said, deserves to be punished. When the patient is going deeper, you only kind of lead them to the next step. So I just repeated what she said. She's saying, deserve to be punished? I just repeated. She says, yeah. You know, doctor, I'm in an extramarital relationship and my boyfriend also cheated on me. He made me look like a fool. That is the time when my arthritis started. You know, that is the ailments from when I was talking to you in the beginning, that you find out the causative factor, even the mental causative factor. And in arthritis, rheumatoid arthritis, there very often will be a mental situation after which the arthritis took started off the process, because it's an autoimmune disorder. So therefore has to be a state that kind of triggered the process. So she says, I was having an extramarital relationship and I was cheated and my arthritis started. And the feeling was, I have cheated on my husband for another man, and this is God's way of punishing me by giving me arthritis. So, see, in all situations, she feels betrayed, let down by her friend, by her boyfriend, and her feeling is that I have done something wrong and God is punishing me for my arthritis. So, there is a delusional level, it is much, much more deeper than the emotional level. So I needed to understand further. So I said, what dreams do you get? Because, dreams are a beautiful method to get to our subconscious, to our, what we call an uncompensated state. You can dream about what you cannot actually do in reality. So that is something that is not masked. You can dream and you can say it was a dream, no? But if you do that in reality, it is not advisable, or it is not acceptable. So dreams, I think, if a patient can tell me a dream, I'm very, very happy. But if they cannot, it's also okay, because then they are not at the fourth level or the delusional level. They are still at the emotional level and they require a lower potency of prescription. So here I asked her a dream and she says, I don't know what's happening in this dream. I see a fight happening and a close person is getting hurt and getting badly hurt. And I'm right there in the dream, but I'm doing nothing about it. And I wake up confused and guilty. Why did I not intervene and help when I could? So this is her delusion. A person close is getting injured and I have refused to open my eyes to it. I've just shut my eyes to a person who is getting injured. So it is almost as if I'm doing something wrong. I'm closing my eyes to the affection of another person. She feels very, very guilty of having committed a crime. But she says, but that is a dream. But that is also her reality. So what do we see in this case? There is a very strong mental state. There is a feeling of being betrayed by the person who she's dependent on, be it her childhood chatty-patty friend or be it her boyfriend. And also there is a strong feeling of doing wrong and the feeling that she needs to be punished for it. There is a dream in which she felt she could have done something to help a close person in trouble, but she did not. And she's feeling guilty about it. So how can we now convert this into rubrics? She has the theme of her body not being good. She has the delusion that people are conspiring against her. She has the delusion that she's committed a crime. So we can take ugly. We can delusion conspiracies against him there are. Delusion, crime committed that she has. And this delusion, vengeance, thinks he is singled out for divine. That feeling that she needs to be punished for the wrong that she has done. And there's a beautiful rubric which has only one remedy. Delusion, imagination, brother fell overboard in her sight. What is the thing? A very close person fell overboard in her sight and she did nothing about it. Very similar to this man being beaten up in a fight and she being right there and doing nothing against it. So she allows something wrong to have happened, and also anxiety of conscience. And that is the theme of Kali Brom. If I repertorize this case, it is Kali Brom. And if you understand Kali Brom from the Materia Medica, from Shankaran's substance of homeopathy, we know there is impression from his danger from his family. He constantly feels that the very family whose support he needs, that is the Kali, can harm him. So Kali Brom is from the 4th row of the periodic table, and Kali is column 1. Bromine is column 17. What does the column 1 say? Column 1 says extreme dependence on somebody close to them. And bromine is column 17, which is the halogen, which has a feeling of being betrayed, let down, stabbed in the back. So, what is the combination of Kali Brom? It is that the same family or the closest person in my family whose support I need, that person has betrayed me, put me down, has conspired against me, has harmed me. And this was the theme of this case also. And I will read this a little bit from Substance of Homeopathy about Kali Brom. They are extremely anxious, constantly anxious, as if somebody from their family is going to pounce on them. The feeling is naturally aggravated when they have done something wrong or they feel they have done something wrong. So, thus, that the least reason they feel extremely guilty as if they had committed a crime and they're going to be punished by the parent figure. That is exactly how this patient has his own delusions. So the prescription I made was Kali Brom 1M. And this was again a level 4 case, and it was a deep-seated pathology on the mental level. So I did a prescription of the centimil scale and of 1M potency, and she did beautifully well. Her pains got much better, so I did a recent follow-up. I called her up to find out also she's much better with the pains, and the knees are better. She's been able to walk longer, but 70 to 80% reduction in the knee pains. The backaches are gone. She is in a mentally much better place. That constant feeling of having done wrong, or the dreams of guilt are no longer there. She says that now I don't think I have done anything wrong or has I require punishment for it. Again, she had a situation where some very close friend betrayed her. But what was her experience? I think it is her karma and she has to deal with it. She no longer felt that the person I'm dependent on is now, putting me down or betraying me or stabbing me on the back like a bromine does. But she says if she has betrayed me, it is her karma. She needs to deal with it. So that is how we bring about an overall improvement in the state of the person. So when the mind is better, the body also feels better. So I feel, in such cases, if you heal the state of the person, you heal the person as a whole. And it is very important in joint complaints to realize what and how deep is the pathology or how deep is the mental state. And then it becomes easy for you to make a prescription. So I, in this lecture, have told you how we deal with acute prescriptions in joint complaints, simple joint pain, very chronic joint pain. And there has been a local pathology, but there has been a long, deep-seated mental state. So you will have to decide, depending upon what you are seeing in the patient, how you would like to take the case forward. So there is no right, there is no wrong. See what is there in front of you and prescribe accordingly. Thank you. With this, I come to the end of my presentation for today. And there are any questions?
Dr. Rindhu, whether there are any questions in this? I think
in the YouTube link, there are so many questions. Most of them asked about in the potency.
Okay.
Then regarding the potency, ma'am, in acute prescription, in which potency you are giving?
So again, you take according to what is the pathology. If it's an acute prescription, I prefer to give a low potency and repeat frequently. Again, depending upon the situation. So
Okay.
you want to repeat till the symptoms and for a short duration of time. So depending upon what the case is, you might want to give for 2 days, 3 days, or 7 days, and you can repeat. So you can give a 30 potency and repeat it maybe 2 times, 3 times a day. depending upon the case. If it's
Okay.
a constitutional prescription, as I told you, I see at what level the case is. So accordingly, I prescribe. And if it's a deep-seated pathology, which will be degenerating further, then I will take in the centesimal scale also and prescribe accordingly.
Then when Dr. Mahendra Pratap Singh asked about acute elbow joint pain, which medicine has to be taken?
What is the name of the doctor?
Mahendra Pratap.
Okay, Dr. Mahendra Pratap Singh, see, right? So, you know what? I can never tell you that for acute elbow pain, give this remedy. As I spoke in the beginning of the lecture, you have to see what is happening. So, you take the history, what is the cause of the acute elbow pain, whether it is a tennis elbow, whether it's an injury to the elbow, whether it has been overused, at the elbow and there's a bursitis there, and then the kind of pain that is there. So you will match the symptom similarity of what is the condition and prescribe it. There is no one medicine for one condition. That is not the way. That is not how I prescribe. That's why I showed you those 12, 14 remedies which I use for the prescriptions, and there are many more I use. But those are the ones that commonly used. So that's how to select upon the symptoms.
Then one more question, ma'am, about the miasmatic approach by Dr. Ayan Khan.
What is the question about the miasmatic approach?
Miasmatic approach in joint pain.
What does he want to know about miasmatic approach in the joint?
That doesn't mention what is a miasmatic approach in joint pains.
So you also use the miasmatic approach depending upon, we use the 10 miasms that Dr. Shankaran has also, found out in between the normal SORA, psychotic, syphilitic, and cancer miasms or the tubercular miasms that are there. So sometimes for the prescription point of view, the remedy which deals with that particular miasm, we will prescribe. I generally don't really give just an anti-miasmatic in between my prescriptions. That is not how I practice, but if there is a person who's practicing that way, they'll be able to answer this question better. We only use if the remedy has that miasm indication, then we will prescribe.
Ma'am, doctor, there is a question in the chat box. If kingdom theme match and pathology does not match with the remedy, what to do?
So it depends upon what is the depth. What is it? Like this Kali Brome case, all right? So I went and saw many books in Kali Brome that I did not see rheumatism of the knee joint or rheumatoid arthritis anywhere mentioned. But the state was very, very strong. And that's why I took the kingdom approach. So if the state is the reason for causing the problem, then you will prescribe accordingly. But if you know the what is presenting to you is primarily the pathology and there is no physical state, then you make a pathological prescription. And that's how you do it in all cases, not just joint pain. To see what is there in the case and accordingly prescribe.
Okay, ma'am. Ma'am, can you just tell about the thing that different pains are in the family? The plant families are more sensitive. So there are different kinds of pains in the families now. So how can we differentiate according to the pain between the family? Because in the Ranunculacea composite, there are in the Papaveracea, there are family, the pains are different. So how we can use that in differentiating medicines in pain?
Good question. So you know what? We don't just use the pain to differentiate the family. When we are making a prescription depending upon the family, then you are taking the whole gamut of the mind and the body and the physicals together. Like for example, we had a case of butyroline that was prescribed for toxicodynamine. Correct? And in that, the theme of the patient running was injury. And the injury was on the physical and on the mental level. And that's why it was the composite family that was utilized and used in this prescription. So there is no differentiation per se, Dr. Deepu, that if the pain is like the composite family, I will give the composite family, or the pain is like the Ranunculaceae family. No, if the pain is sharp, shooting, unbearable, drives the patient to a frenzy, and has all the other symptoms of the Ranunculus family, then you will make a prescription in Ranunculus. If the main theme is injury and inability to being approached, does not want to be touched, and feels injured in the mind and the body, then you will take the Composite family. So you will not differentiate just the pain on the family root. As Dr. Shankaran has said, the sensation method and the kingdom differentiation is used at the delusional level. So you will not use the sensation method at the local level or at the emotional level. So you will never ever differentiate just the pains on the sensation method.
Got it, ma'am. But in some remedies like Phytolacca, there are lightening type of pain, and in some remedies, the pains are different types now. So sometimes we may not know that kind of pain can be in another remedy. But the mental match, as you rightly pointed out, if a patient is matching on the delusional level and it is not matching on the physical level, can we, if there is any significance, rightly, as you just in the last case, you go to the calibro. So whether we can give a plant medicine means not only because of that characteristic we can do, but if the sensation is very much similar to the medicine which we are prescribing on the basis of the type of nature and the appearance, and that does not match us the delusion, should we go with the remedy which we have in hand?
So if the patient is on the delusional level, that's a higher level. That's level 4 in the case, right? So whichever is the highest level, you will prescribe more on that than on the lower level. So when you are already at the delusional level, you will not take the pain symptom to be as highest ranking. You will take the mental generals more as a higher ranking in your repertorial totality. So that's how you will do the case. You will never ever use the sensation method at the fact level or the name level, Dr. Deepu.
Okay.
That is
Yes,
where most of us make a mistake and start using the different families. Delusional level case or it's a sensation level case. Actually, what he says is when the case is at level 5 at the sensation level, then you will differentiate.
Got it. In the doctor, you can continue. Yeah.
Okay, Dr. Hetal Mehta, she asked how to go about in a case of rheumatoid arthritis and its prognosis. What result to expect? How much time to wait for titer to come, etc.
All right. So, what I have seen first is to investigate at the beginning of the case. So you know exactly, what is the CCP level, what is the RA factor level, if the ANA is positive or not. So you will do that in the beginning, and then you will take the whole case and prescribe, and you will repeat the test every 6 months. I don't like to repeat. Yeah, sometimes if the CRP is very high and the ASR is very high, I may just repeat the CBC ESR and see the CBC ESR and the CRP should reduce within 2 to 3 months for sure. But the RE factor takes longer to reduce. So every 6 months you can do the test and see the titer comes down if you are in the right. But the best thing is the symptomatic relief that initially the patient starts getting. That's one. And then the deeper emotional level relief that he also gets. That's when we see that the chronic situation is getting settled, and that's when the RA factor also starts settling down. But when the inflammatory process is down, then the ESR and the CRP will come down. So that comes down faster in rheumatoid arthritis. Then comes the RA factor, right? Any other questions?
Dr. Simran Navni, she has asked about Naja was coming close in Calibron case. Can you please differentiate it?
Naja, see, that's from the animal kingdom, and that is also a remedy from the reptile group. So, and Kali Brom is a mineral kingdom, Bro 4, salt, Kali, and bromine. So, the main differentiation would be at the root kingdom level, if we are seeing, the mineral kingdom thinks that they lack something or they are losing something. In the animal kingdom, they feel that somebody has done me wrong. I need to get back to the person. Naja is a more dignified reptile. They feel they have been wronged, but they feel the need to get back. The revengeful, vindictive nature does come back in an animal. If you do wrong to me, I will do wrong to you. We did not see any animal features in this case. There was a wrong that was done to her, but her experience of the situation was, I was betrayed by the person who has done me wrong, and I need to be punished for it. So she never felt that somebody else needs to be punished. A Naja would want that person punished, although they may not do it themselves physically, but they will definitely have the vindictive nature. So you have to see the whole picture in itself and then prescribe. Okay, anything else?
Dr. Pillai asked about Parkinsonism correlate to osteoarthritis. Is there anything to consider for prognosis once treatment we start in such cases?
I didn't understand this question. What about Parkinson's and osteoarthritis?
Parkinsonism disease correlate to osteoarthritis. Is there anything to consider for prognosis once treatment we start in such cases?
See, Parkinson's is again a degenerative disorder of the mind. Osteoarthritis is a degenerative disorder of the bones and the cartilage. So I think the pathology in both is different. Yeah, both are degenerative disorders. So I don't see any similarity. Your case may have both. So I don't see any similarity between the two pathologies. So I don't know what is the meaning of this question. Is there anything else he'd like to understand so he can write further?
Okay, thank you, ma'am.
So I'm also, you know what, if you want, you can write down my email ID. And if there are any further questions also, we can definitely, you can write an email to me. I generally answer within a day. And we can, if there's anything specific you further want to know also, I'm very happy to. Yeah.
Okay, thank you, ma'am.
Right.
Please share your mail ID.
I will show you the slide. Right, so it's Dr. Sunita Gandhi 1@gmail.com. All right. So anybody else needs any more further clarification, you can ask me there.
Then some question regarding joint stiffness, ma'am. Simply about joint stiffness. I don't know what he means. Ligament stiffness.
Symptom similarity, match the stiffness. There are so many remedies that have stiffness in it.
Okay.
So many pathologies also that have stiffness. So stiffness is a symptom. That's what
Okay,
it is.
Okay. Then Dr. Gulabchand, a patient with rheumatoid arthritis, 40 years, with small joint pain, how to proceed?
5 steps. Take the case, do the investigations, examine the patient, and prescribe, and then do the prognosis.
Okay.
Rheumatoid arthritis, systemic illness, like a regular routine.
Okay, thank you, ma'am. Any other queries regarding this session, please? I think no questions more. So, really, ma'am, it was indeed a wonderful session. It was a very, very nice class. Now, I'm inviting Dr. Jasmine for vote of thanks. Dr. Jasmine, please. Hello, Dr. Jasmine.
Dr. Indu, I think she has some network issues.
Technical issues. Okay.
Okay, I'll do the honors then.
Okay.
Ma'am.
Can you hear me?
Yeah, she's Dr. Jasmine, are you here?
Can you hear me?
Yes, you can continue, doctor. Okay, yes.
Good afternoon, ma'am. Good afternoon, dear doctors. And it was really a wonderful, inspiring, energetic class. Ma'am, you inspired me and every doctors a lot. Actually, I hope all are interested in this section. You all are managing this type of joint pains with homeopathic medicines, and also we know about a huge percentage of persons are suffering from these joint pains, a large number of types of pains. Here, I remember one thing that a family friend, he's a famous orthopedic surgeon from a reputed hospital. Once he told me that about 30% of surgical cases that happening in the hospitals are truly unwanted. It's only because of the target that they wanted to the hospital. So on this time, we have to focus our scope of homeopathy in this field, because that's otherwise the fate of the patients we must know. So we have to do much for the patients, has also with a humanitarian mind. And I would, from today's session, we all are courage little more, because ma'am told about the all cases with deeply, and we homeopaths not only prescribe with acute or just prescribe the details and go through the investigations, then the diet and regimen, all things. Then only we have to take the patients in a freely or positive mind. So I want to give a lot of thanks to our respected Dr. Sunita Gandhi ma'am for your valuable time that you have spent for us. And thank you ma'am on behalf of IHMA Ernakulam chapter, IHMA Ernakulam district. Would like to express our deep gratitude to ma'am. Thank you. Thank you ma'am.
Thank you very much. Thank you for the kind words. And I'm glad the lecture was useful to you. Thank you.
Okay,
Thank you,
ma'am.
ma'am.